Autistic people are more prone to depression on a statistical basis, and in the postnatal period, your healthcare professionals, your healthcare team will be looking out for the signs and symptoms of postnatal depression and encouraging you to do the same in yourself. So postnatal depression can be typified by exhaustion, struggling with self-care, struggling with socializing, struggling with activities and to leave the house. And there can be issues around either hypervigilance of the baby or struggling to bond with the baby. But autistic people are also much more prone to burnout than non-autistic people. So the signs and symptoms from an external observation basis can look similar, because people in burnout can struggle with self-care, they can struggle with low mood caused by low energy, so they can struggle with motivation. And for autistic people, we can have a dropping of our mask, and so we can struggle with socialization and struggling with non-direct communication. But the causes are quite different. Depression tends to be caused by, there can be a hormonal element in the postnatal period, and then it can also be caused by trauma related to the birth and or changes in your life related to entering parenthood. Whereas burnout tends to be caused by overwhelm from too many demands. So that can include demands in the sensory environment and demands in the social aspect of communicating and behaving in a non-autistic way. The treatment for depression versus burnout can look quite different too. So depression tends to be lifted by, there can be an element of hormonal treatment, there can be antidepressive medications, and some peer support and or therapy and counselling. Whereas burnout tends to be improved with lots of rest and rejuvenation, practicing self-care, and also working with a counsellor or therapist who is experienced with autism, autistic people and autistic burnout. If you are experiencing the signs and symptoms of either depression or burnout, it is important to seek help and seek support. If you reach out to your healthcare team and you feel that they are not reaching a correct diagnosis for you, you are always welcome to seek a second opinion and make sure that you are travelling down a route that feels right for you treatment-wise. Thank you very much. I hope you found this helpful.